So hello everyone, I am Monica Di Guzman, a student nurse from Davao Doctors College. And so for today, I'm going to do the BLS or Basic Life Support of an Adult and AAD skills, the Pediatric Resuscitation, Infant CPR, and Newborn Resuscitation. And BLS or Basic Life Support is performed to support a patient's circulation and respiration through cardiopulmonary resuscitation until the advanced life supports arrive. So without any further ado, let's get started. Now I'm going to do the adult cardiopulmonary resuscitation and of course an AAD skills. So prior to perform the procedure, I am going to activate for our assessment. So let's assume that I arrive in the scene and I saw the patient lying and appears unconscious. So the first thing that I'm going to do, I'm going to check for the safety of the scene. So I'm going to check for the environment to see if there is any hazards that can aggravate the patient's condition and can harm me as well. So if it is clear there's no hazard, so we're going to do the next step. So we're going to check for a response of the patient by tapping his or her shoulder. Sir, are you okay? Sir, are you okay? Say, sir. So if you don't receive any response from the patients, we're going to activate an emergency response system. So we're going to shout for any help. Sir in black, please call 911. We have an emergency patient here. So next we're going to feel the pulse of the breathing, and we're going to look for the rise and fall of the patient. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So after doing that, there's no pulse, there is no rise and fall of the patient. So we're going to proceed for the next step. We're going to do the high quality compression. So we're going to put our hands on the lower half of the sternum, and we're going to give 30 compressions of the patient. So we're going to make sure that that we completely recoil each compression. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 7, 8, 9, 30. So after doing that, we're going to do the we're going to give 2 breaths from our patient. So in order to do that, each breath consists of 1 second, and we're going to look for the visible rise and fall of the chest of the patient. Now, of course, we're going to use a mouth barrier to have a preventive measures. So now we're going to continue the chest compression in less than 10 minutes, and while waiting for the AED to arrive. Now assuming that I am the second rescuer, so I am going to turn on the AED, and I'm going to scan the abdomen and the chest of the patient to see if it is hairy or the patient soaked in water. So if it is nothing on his chest, so we're going to proceed to put the patches on the right side of the patient, just above the nipple line. And next I'm going to put the other one on left side of the patient, just below the nipple line. So right now we're going to wait for the analysis, and we're going to clear to deliver the shock. So everybody clear, shocked, deliver. So right now we're going to continue the compression. We're going to continue the compression in at least 5 cycles, and we're going to to listen, look, and the rise and fall of the breathing of the patients, and of course we're going to feel the pulse of the patient. So after that, we're going to establish a good practice of team dynamics. So right now I'm going to do the pediatric resuscitation. So the pediatric and adult CPR have the same procedure, but the only difference is on how are we going to do the compression. So the first thing that we're going to do is to check for the safety of the scene. We're going to check the environment if there's any hazard that can aggravate the patient's condition and that can harm me. And next, we're going to check for the level of consciousness of the patient. So we're going to check for the response. So we're going to check for the response. We have to tap the shoulder of our patient. Baby, baby, can you hear me? Baby, baby, can you hear me? Baby. So if you don't hear any response from the patients, we're going to activate the emergency response system. Sir in black, please call 911. We have an emergency patient here. So next, while waiting for the response team, we're going to check for the breathing of the patient. So we're going to use the feel, listen, and look method. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. After that, if there's no breathing, we're going to give the rescue breath to the patient. So after that, if we're going to check for the sign of circulation, so we're going to feel the pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So if there's no sign of circulation, so we are going to do the cardiopulmonary resuscitation. So for the infant, we're going to use the 2 to 3 fingers technique. So we're going to locate the correct site for the compression. So I'm going to put my fingers in the lower, below of the nipple. Then we're going to compress about 30 compressions with at least 100 to 120 compressions in a minute per minute. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now we're going to give 2 rescue breath for the patient. Now we're going to continue the compressions for at least 5 cycles, and each cycle should contain 2 rescue breaths. So now for the child, so we're going to use one hand, and we're going to put it and just below the nipple. So we're going to do a 30 compressions of at least 100 compression per minute. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then after that, we're going to give a 2 rescue breath for the patient. So we have to give 5 cycle of compressions, and we have in each compression should contain at least 2 rescue breath each cycle. So right now we're going to we're going to pause and look for a sign for of circulation. So if we're after that, we're going to position the patient into recovery position. So how are we going to do that? We're going to we're going to position the patient into a left side position to avoid aspirations of vomit. So right now we're going to document the time. We're going to document the time of the start of the procedure and the time of recovery. So right now I'm going to do the newborn cardiopulmonary resuscitation. So how I'm gonna do that? I'm going to first to evaluate the APGAR score of the patient. So APGAR score is a test wherein you're going to conduct that in the first 1 minute and 5 minutes after birth. So let's assume that our newborn has a 3 APGAR score, which means that the newborn is in a concerning range and needs an immediate resuscitation. So after that, we're going to check for our response for by tapping the shoulder of the baby and by rubbing the sole of the baby. So, baby, are you okay? Baby, are you okay? So, if you're not receiving any response from the newborn, we're going to ask for a help. So, we're going to say code blue, or we're going to say doctor squeak, so that the doctors and other nurses we're going to will come and will help us. So next we're going to open the passage of the air passage way, and we're going to do a suction if necessary. So next we're going to do the positive pressure ventilation. So as for me, I'm going to use a bag mask. So I'm going to attach the bag mask and allowing bag mask and cover the nose and the mouth of the baby, the newborn. So allowing 30 seconds ventilations. So in order to do this, we're going to watch the rise and fall of the chest of the newborn. Breathe through 3, breathe through 3, breathe through 3, breathe through 3, breathe through 3. And after that, we're going to have someone to attach the cardiac monitor or the pulse oximeter to the patient. This is to monitor the efficacy of the CPR. And next, we're going to do the chest compression. So chest compressions for newborn has two types of techniques. So for first technique is we're going to use the two to three fingers or technique, and the other one is the thumb to thumb technique. So as for me, I'm going to use the 2 to 3 techniques compression. So we're going to put our fingers in the lower or the lower just below the nipple of the newborn. So we're going to do the chest compression of 1.5 inches. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then we're going to do the breathe. So after that, we're going to continue the compressions for at least 4 cycles. So after doing the 4 cycle of compressions, we're going to monitor the heart rate of the patient. So if the newborn has less than 60 beats per minute, we're going to continue the chest compressions and assess for intubations, and to assess for by giving any medications. So however, if the patient has a more than 100 breaths per minute, we're going to do the post-resuscitative care. So this is to monitor the administered oxygen saturations. So after everything, after the procedure, we're going to document the assessment, the procedure, the medication given to the newborn. So we're going to document that for the database of our patient. So right now I'm going to do the infant CPR. So the first thing that we're always gonna do is to check for the scene. So check the safety of the scene. So if it is clear, we're going to check for response and observe the breathing of the patient. So if we're going to check for a response, we're going to tap the shoulder, or um, we're going to tap her soul. So, baby, can you hear me? Baby, can you hear me? So if you don't hear any response from the infant, we're going to send someone to activate an emergency response system. Sir, in black, please call 911. We have an emergency patient here. So after that activations, or while waiting for the for a help, we're going to check the pulse of the infant. So it will be less than 10 seconds. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. After that, if there's no breathing at all, we're going to do the CPR, or cardiopulmonary resuscitation. So the first thing that we always do is we're going to use the two to three fingers, and we're going to put it in the just below the nipple. We're going to do the compression 30 times, 30 compressions, and each compression should contain 2 rescue breath, and we're going to do it in 1.5 inches. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So after that, we're going to give 2 rescue breath. So the compressions and the 2 rescue breaths should be enough. We're gonna do it at least 5 cycles. So each cycle should contain a 2 rescue breath. And now we're going to let's assume that I am the second rescuer. So the second rescuer bring the bag mask. So in the 5th step of set of compression, so we're going to switch roles. So I am going to do a compressions that contains 15 compressions in 9 seconds. So we're going to use the thumb to thumb technique. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And then we're going to use the bag mask to give the 2 rescue breath. 1, 2. And then we're gonna do that in the 2 cycles. So each cycle should contain 2 rescue breath. And the next, after the 2 cycle, we're going to switch roles again, and then the second rescuer will gonna do the chest, the compression. So assume that I am the second rescuer. So I'm going to do the second the 2 cycle of compressions that contains only 15 compressions. And also we're gonna use the thumb to thumb technique. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So 15 compressions with 2 rescue breath using the bag mask. 1, 2. So after that, we're gonna do it in a 2 cycles. So each cycle should contain 2 rescue breath. And we will also have to do that in a dip of 1.5 inches.